Assalamu alaikum, everyone. Welcome to the Soul Healing Foundation. Soul Healing Foundation is a non-profit organization that is run by clinical psychologist Ma'am Sajida Kazmi. Soul Healing Foundation works for the betterment of psychologists and it strives in spreading awareness about mental health.
You are never alone in this journey. Let's find the light together. We are Soul Healing Foundation and we are celebrating Mental Health Week.
Assalamu alaikum, everyone. I am Zarmeena Al Kareem, a student of MS Clinical Psychology from Rifa International University. I am currently an intern in Fauji Foundation Hospital, Rawalpindi, under the supervision of clinical psychologist Ma'am Sajida Kazmi. I'm also a member of Soul Healing Foundation, which is a nonprofit organization working for the betterment of psychologists and spreading awareness about mental health. I welcome you all to today's podcast. Today, we'll be discussing suicide, its prevention, prevalence, prevention strategies, thought-stopping techniques, causes, and so on. We have Miss Laiba Waheed as our guest speaker today. She is a psychology student in Fatma Jinnah University, also a member of Soul Healing Foundation. Thank you so much, Miss Laiba, for joining us today.
Welcome. I'm really grateful to you for having me today.
You're welcome. So starting off, we're going to start off with a general discussion, how it's really important for us to acknowledge and recognize the fact that many people do have suicidal thoughts. And it's whether they're diagnosed with a mental illness or not. They may go through times where they feel like there's no light at the end of a tunnel or they can't see one in a certain moment. They need connection, they need support, they need acceptance regarding suicide. So starting off with the introduction, how would you define suicide? How would you say that the thoughts, the feelings that come with it are manifested in a person?
Okay. First of all, let's discuss what exactly suicide is. And if we talk about suicide briefly, it is basically an act of intentionally taking one's own life. So we see how tragic and complex this phenomena is. Basically, it is backed up by many factors which people don't really care about. And in our society, those factors are undermined. These factors may be mental health issues, emotional distress, societal pressures, and they can be personal circumstances. So suicide is a very significant and very pressing public health concern worldwide. It's not just that Pakistan and the people of Pakistan are facing this issue. It's not that. Even we talk about Asia, no, it's not over there. It's not just over there. It's like it's an international issue. And I feel like the crisis intervention and the process of raising awareness about the risk factors and warning signs associated with suicidal thoughts is a very crucial thing that we need to do.
Exactly. So moving on towards the risk factors, who would you say are more at risk for attempting suicide?
See, we both are student of psychology, and if we talk about mental health, even if we talk about Pakistan, just let's take Pakistan for example, for instance.
Okay.
If you talk about our own nation, then people, they mostly focus on physical health. They're like, if they'll go to doctor, they'll consult people if they're physically ill. But mostly, if we talk about these illness, these ailments, they are backed up by mental illnesses. So I guess when you talk about suicide and the warning signs and people who are mostly exposed to this thing and they have this high risk of developing this condition, it's like people who are more exposed to mental health conditions. And we also talk about people who are diagnosed with mental health disorders like depression, like bipolar disorder, anxiety disorders, schizophrenia. These people are more you exposed to this thing, and there's a high possibility and there are high risk of it. And secondly, when we talk about, there are certain people who have already just attempted this thing, people with previous suicide attempts. So
Exactly.
individuals who have properly attempted suicide, I guess they are at very high risk of developing this issue. And thirdly, when we talk about people who have a family history, like a family history of suicide, and people may say that how can someone have a history of suicide? But obviously, there can be a person may have either their grandparents or somebody from their ancestors. Obviously, the history comes from them. So there may be a family history of suicide or mental health disorders, even if you talked about mental health disorders earlier. So there may be a factor that may, just get them exposed to this thing. And next on the line is obviously substance abuse. We see Pakistan is obviously facing this high issue of drug trafficking, and people have been working in this area of narcotics. So I guess substance abuse is one of the thing that leads towards this issue. And then there are relationship problems. Even if we both have been working in the clinical setting, and we saw so many issues, those are basically, and the
Exactly.
root causes, they are just, they if we try to recognize them, there'll be just relationship problems. So people are facing so many relationship problems, and last but not least, it's the most important one. People in Pakistan, obviously, since the inflation has been rising, people have been facing this issue of financial instability.
Exactly.
Even the people who used to afford, who were able to afford so many necessities, so many things, they are even, they are uh, striving to, pay their bills, and so many other things have been, contributed to this factor. Social isolation, we talked about this thing in class earlier. Social isolation is also a thing that has been, people are basically isolated. They don't really talk about it. We just had a patient earlier these days, and the patient, she quoted this thing that we don't talk about our personal problems
Exactly.
among our family members.
We
And this
don't.
is something we really need to raise awareness about. Like, family members are this or significant ones. They are the ones who are supposed to understand us. But I don't know why people, they just back down, they just back out from this thing that they really need to talk about it. So people, rather than, I don't know, I guess there's this factor of embarrassment. They feel embarrassed for, the problems they have been facing. Like, there's this stigma of mental illnesses. So there are these stereotypes. There are so many contributing factors. Those don't really let them talk about the problems that they have been facing. So since they don't talk about the problems, there's this frustration that keeps on building into their minds, and there are so many clutters in their minds, uh, and this is something that just keeps them back from it. And there are so many there's one more factor that I wanted to talk about, and that is sexual orientation and gender identity.
Yeah.
Like, even if we talk about DSM, there are so many the disorders regarding gender identity and sexual orientation that has been added to it. So there are so many risk factors, and I guess those people who actually fall under these categories, they are more exposed to it.
Exactly.
So yes.
Okay, so you addressed a very good myth about suicide earlier, where you mentioned that people who have attempted suicide once, or they have attempted suicide, okay, so they are more at risk.
Yes.
Where there's a very big myth about this factor, where people say that, people who have already attempted suicide would not go for another attempt.
Yes. Yes. This is something that needs to be quoted, and this is something we need to raise awareness about. Obviously, we are the ones who are actually in this field. We know all of these myths. I guess you would have also witnessed this thing where patients come and their suicide count is more than 2 or 3. So this
Exactly.
is very alarming that at the very first stage, if the intervention was given, I was also reading the content, and there was this thing, the role of early intervention in suicide
Exactly.
prevention. So I guess early intervention is something that needs to be focused on.
Yeah.
See, if a person is like, if a person is verbally quoting this thing that I don't feel like, I don't feel good with my life, I'm having this existential crisis, or I don't feel like myself, I don't feel like I can continue this life anymore. Obviously, the person is verbally quoting this thing. So I guess if this thing can be addressed at the very first place, people won't even go towards this thing, and they won't even consider this thing as a second option. So I guess that at the very first stage, that when this thing is witnessed that the person is has committed suicide, people should gather up, the families should gather up, even if they have friends, even if there is somebody who, if you care for a person, you should go for them, and you should go and talk to them, and you should just we should not take these people who have committed suicide as statistics. We
Exactly.
should take them as people who need our help, who need our aid. And we, being somebody who is normal, we should go for it. We should go talk to them. And even if they are not, they just don't want to talk, we should be there for them. We should make them realize. Obviously, the person who commits suicide, they are so much depressed, they just cannot see any sort of bright side. This is a very huge step that they take from themselves. And this is a very crucial thing that people need to do, and we should raise awareness, especially regarding to this thing, that if a person has committed the suicide, we should make them realize that we are there for you. Because if they have this schema, that obviously if they visualize themselves in a safe place, they wouldn't have done it at the very first place.
Exactly.
So I think making them realize that we are there for you, we are going to help you out, is the very pressing thing that we need to do.
Exactly. Exactly. So talking about what people quote or what our patients quote, about I don't feel like myself, or nothing's right, or existential crisis. So I think all of those would be included under warning signs. So how what warning signs would you say that we as normal citizens should be aware of when it comes to the risk of suicide?
First of all, as I mentioned earlier, it's about the verbal confessions, because obviously, if a person is so depressed, they are, taking this bigger step, this huge step about their life. They're making their mind is so cluttered, it's so blurred from negative thoughts. They just cannot think about any sort of positive affirmation, even if they try to. So I guess the person who is actually experiencing suicidal thoughts, they'll express it. They may be giving you signs. They may give you a sort of verbal sentence, even if the person is saying that I want to die, I don't want to live anymore, I don't feel that I am of any use.
Hmm.
These sentences, this is obviously the person is confessing at your face. So you shouldn't just ignore it, and you shouldn't just, associate it with attention seeking behavior. So
Exactly.
there's a fine line between attention seeking behavior and somebody who's actually depressed, and they may go on and take this huge step about their life. So the second one warning sign, I guess, there is that maybe about the preoccupation with death. They may be always talking about death, about dying, about their afterlife, and about, they may be searching about the ways. So if somebody is coming to you and they are even asking you a question like, what's the easy way to die? Obviously, what is the person referring to? So you just shouldn't be telling them the easy ways to die. You should obviously talk to them. You should be like, talk to me. What's the problem? Like, why are you even asking such questions? So I guess this is something that the person needs to, we just need to overcome. And see, the person who's about to commit suicide, we may notice sudden behavioral changes in them. Um, and these behaviors maybe, there may be this sudden appearance of the red flags,
Yeah.
so they may lose interest in social activities. Their behavior may be changed, like they may get annoyed at very small things. So they may lose sleep, they may lose their appetite. So we should notice these behavioral changes. Like if you have a friend and the friend, they used to go with you, they used to hang out with you, and suddenly something happened. You may not know what happened, but your friend, they just turned into somebody who, just isolates themselves from these things, and they say that I don't feel good going out.
Hmm.
So these are the behavioral changes. Those are quite sudden, and they are, I guess, they are quite, recognizable. See, we should be mindful. We should be somebody who sees. I was reading a post, and it was like we should pray for our friends, because we don't know what the other person may be feeling or what the other person may be going through.
Hmm.
So there may be the sudden behavioral changes, or there can be a thing that the person may try to say you goodbye, or even even the person may come to you and ask for forgiveness. So these are the small cues that we need to identify. These are the small warning signs. And one more important thing that the person with the suicidal thoughts may do is that they may engage themselves in very risky behaviors. Like they may do reckless things. They may get themselves involved in substance abuse, and certain sort of small crimes like vandalism,
Hmm.
or there can be many other crimes. So these are the certain behaviors. But in order for us to identify all of these behaviors, we need to be mindful.
Yeah.
We need to be that helping hand that actually gets to people, and we actually notice those things. We shouldn't be so much submerged into ourselves that we don't see these little signs around us. So I
Exactly.
guess that's very important. These warning signs are very important for us to see.
Definitely. So when
Yes.
we discussed earlier about family being the first line, um we could say it's sort of like a first line treatment for normal people. When you feel upset, you'd go to your
Yes.
family, you talk about it. When one would feel like they feel like killing themselves, or they feel like ending up their lives, or any such suicidal thoughts, so the family should be the first approach. They should go to them, they should talk to them. But one very, very, very common problem that arises is what we call stigmas. So we're so embarrassed, we're
Yes.
so reluctant to talk about mental health, to engage in open conversations about, even about topics like suicide. It's because we know there are certain stigmas attached to it, and we know we might be judged, even if it's judgment coming from our families. So how do we reduce such stigmas about mental health and encourage open conversations uh, regarding suicide prevention?
Okay, that's a very good question. And I don't know about any other states. Like we are practically living in Pakistan.
Yeah.
So I guess we talk specifically about Pakistan and Pakistani people. So there are so many stigmas, there are so many stereotypes that if we start to talk about them, I guess it'll take us hours, and they'll just keep on reappearing over and over again. So I guess stigmas really need to be pointed out. And the most important factor that I guess according to me comes over here is raising awareness. We should talk to people about it, because most of the times, even if we talk about laymen, people don't really know about these things. So many people in Pakistan who are living in indigenous areas, so many minorities, or people who are not educated enough, they don't know about these stuff. They don't know about these things. Those are happening around them, even if to themselves. So I guess raising awareness, but not even we. I hope this video reaches out to as many people as possible, and they it helps them to gain some knowledge regarding this. But we should target layman, because in Pakistan awareness is something that isn't enough. So I guess stigmas and stereotypes, they need to be, we should fight them. And fighting them is all through awareness, through education. We should, even in the caller hotlines, like, we should talk about these things. Um, and there are so many other areas and so many other means through which we can raise awareness and talk about it and let people know about it. And I guess media plays a very important role in this thing, when we are supposed to raise awareness about something. Social media platforms, because even if we talk about laymen, everybody has Facebook account, everybody has Instagram account, and they are exposed to it, but they are not exposed to meaningful content.
Yeah.
So social media platforms, if we start a campaign, if we start a revolution on the social media platforms, I guess we'll reach out to so many people who are in need, and so many people who actually need these things. They need to hear out these things, and they really need to know these things. So there are several other areas and several other ways through which we can reach out people, but so many of them are through social media. So we should actually take this initiative and reach people out through social media, and we should raise awareness. We should, it's all on us. And we should also go for camps and aware layman about it.
Exactly.
That mental health is something that really needs to be talked about.
Exactly. So you mentioned mental health.
Yes.
We know that mental health promotion, it it attempts to encourage and increase protective factors and healthy behaviors that can basically help prevent the onset of any diagnosable mental disorder. And it can also reduce risk factors, that can later lead on
Yes.
towards the development of a specific mental disorder. So how would you say that we could promote mental health awareness, also alongside destigmatizing the seeking help for suicidal thoughts?
See, for that, obviously, we need to create a safe environment for people first. Like, even if we talk about, hospital setting, when people come to us with a mental illness or mental ailment, I guess they come to us when it's quite late.
Yeah.
See, the factor of early intervention is very important. Even if identify this thing, recognize this thing, that the person may be deviating and the person may be at the risk of this thing, at the risk of suicide, we can save lives. And we can do that by creating a safe environment, by providing people, by assuring people that we are there for your health, and we won't just, make fun of you. We won't just, let you down. If people have enough trust on us, if people, if people had enough trust on their family members or their friends or anybody, if they had that one person they could rely on, they could trust, and they would obviously had reached them out, they would obviously had gone to them and talked to them about this thing that they have been facing. But people don't. In Pakistan, people don't, because they don't trust. And it's because we haven't created that safe environment. Even if the person comes to us and they are giving us, they're giving us indirect cues about it. They're not just directly talking about it. They're verbally expressing this thing. They are doing that thing non-verbally. Or if they're, they started a conversation and they ask us about forgiveness, or they are saying us goodbye, or the goodbye may be forever. So
Exactly.
if the person comes to us, we should create a safe environment for them so that they may be able to talk to us, and they may be able to trust us, and we may be able to lead these things ahead by creating a safe environment
Definitely. But
for these
creating
people.
creating a safe environment, yeah, I agree on that. But how would we let the general public know that what are some effective strategies that they can utilize for identifying and supporting individuals who may be at a risk for suicide?
See, we talked about the warning signs and risk of suicide earlier. I guess if we talk about, raising awareness and letting people know about the risk factors and warning signs, I think we should start from a smaller step.
Hmm.
There are so many schools in Pakistan. There are so many institutions in Pakistan. There are so many helplines in Pakistan. They are non-profit organization like ours in Pakistan. They are good people, and there are people who are there for help. So their agenda is to implement suicide prevention. Their agenda is to develop these policies and these awareness for people. So I guess we should start from the smaller level. We should start from raising awareness in schools, giving people awareness in workplaces, and making these teams at at the various communities. Like you and I may be the advocates for our community, so we can do this thing and we can raise awareness, and our awareness or our talk may reach to the layman, but it has to be through a proper procedure. And we should provide people access to the resources. This is one thing that needs to be highlighted, because if the person comes towards you and the person is talking about this thing that they have been facing, and they have finally opened up to you, what are the resources you are going to offer to them? What are the things, what are the resources, what are the interventions that you are going to give to them?
Exactly.
So I guess access to the resources, access to the, because mostly people, they don't even know whom they should be referred to, whom they should be going to talk to, these things. Obviously we are there to help them, but they must have been referred to us. So what are the interventions those you are going to give them, and access to the exact resources? This thing needs to be highlighted.
Exactly.
And I guess there need to be more open conversations like this about mental health, about suicide. I guess this thing will help us reduce stigma. The more we talk about it, the
Yeah,
more we normalize this thing, it won't be something that is so bizarre or unique. So people won't stigmatize it anymore.
exactly. Definitely.
Thank you so much for watching our video. Please don't forget to subscribe to our YouTube channel. Like, comment and share this video with your friends and family who needs to hear this. And don't forget to follow us on other social media platforms.